This episode of Coronavirus North Carolina News Brief is brought to you by Right By You Mortgage. Wherever life takes you, we're right by you. Visit rightbyyoumortgage.com/podcast to learn more.
From WRAL News and the Capital Broadcasting Podcast Network, this is your Coronavirus North Carolina News Brief for Friday, October 9th, 2020. I'm Brian Schrader. The first full week of Phase 3 in North Carolina brought a spike in coronavirus cases. On Thursday, the state reported the third highest single-day jump in cases, increasing the daily average to 1,784 cases a day. We haven't seen a daily average this high since early August. Mark Holmes is a professor of health policy at the University of North Carolina at Chapel Hill. He says the state and the nation are nowhere near moving past the pandemic. He also thinks North Carolinians took the move as a signal that they could let up on wearing masks and practicing social distancing.
No one's enjoyed these past 6 months. Everyone's tired, and everyone wishes that it was all over and we could get back to the way things were in January, February. And I think striking this balance between what we have for a healthy population versus a healthy economy is a tough nut to crack, and really hard to sort of find that right thing. It's hard to have a healthy economy when we have a raging pandemic.
The rolling average of virus deaths continues a downward trend to 20 per day over the last week. That's the lowest level since July 24th. Both of President Trump's sons planned campaign stops in North Carolina this week, their first in-person event since President Trump's coronavirus diagnosis. This week, Dr. David Wohl with UNC spoke with reporters about the president's treatment.
I think that the president received a very aggressive course of medicines. 2 of the 3 are readily available to people right now. The aspect of his treatment that's not standard is the experimental use of monoclonal antibodies. And while we've seen some good signals for that, we really need to study these. At UNC and across the country, we are studying monoclonal antibodies in early treatment of COVID-19, specifically outpatients, because that's where you really want to use a therapeutic. By the time someone ends up in the hospital, you're rescuing them. What I really want to do is be able to help us find a treatment that prevents people from needing hospitalization.
Dr. Wohl is on the team conducting Phase 3 trials for Moderna at UNC and says he's confident the data will be in place for a vaccine to be approved by the middle of next year.
I think the researchers and the scientists are doing a fantastic job under very extraordinary circumstances. Clinical trials, including the vaccine trials, have been stood up in incredible amount of time. And it's not because of cutting corners, it's because people are working hard. So being firsthand on the front lines of the clinical research, I can tell you, we are doing this extremely rigorously. That is not the problem. The issue is people interpreting preliminary data too soon and to make inferences from those data that can then lead to changes in care and policy. So that's where I think the danger comes. The Moderna trial is a very good example. Here's a novel vaccine that was developed, tested in Phase 1 and looked very safe. We saw antibodies being developed to people who got it. That's great. That justifies its moving on to the next phases.
And Wake County will continue to offer free testing next week in Raleigh and Wake Forest. The 2 locations will offer a combined 5,000 time slots for anyone experiencing symptoms to get tested. And you can get more information on the county's website. This has been your Coronavirus North Carolina News Brief for Friday, October 9th, 2020. Let us know what you think of the podcast. Leave a rating or review wherever you listen, and be sure to subscribe so you don't miss a new episode. I'm Brian Schrader. Thanks for listening.
When it comes to buying a new home, you want to know that you're in good hands. At Right By You Mortgage, the dedicated team of lenders live in your community and are committed to being right by you every step of the way. Whether you are a growing family, a relocating professional, or a retiring couple, they'll partner with you to find the right loan to fit your unique home buying needs. Plus, with a Right By You Mortgage on-time closing guarantee, they'll pay you and the seller $500 if you don't close on time. Visit rightbyyoumortgage.com/podcast to get started. Wherever life takes you, we're right by you. Go to rightbyyoumortgage.com/podcast for full details. Equal housing lender, NMLS number 402136.